Welcome to our ADHD monthly practice call. Our agenda for today is going to be a little bit different because we are trying to make time for the schedules of some of our presenters. So we're going to start out with a presentation from Allie Stevens on the PDSA Wizard, and then we'll move on to roll call and report on our PDSAs. I'll talk to you a bit about the clinical questions for this month, and we'll have some reminders and announcements, and a data review with Jen Powell. A couple of housekeeping items. Please mute yourself if you are not speaking, and do not put your phone on hold. And please, it's always encouraged to ask questions and make comments anytime. And the slides and a recording will be made available after the webinar. And with that, I will turn it over to Allie Stevens, who will have a quick presentation on the PDSA Wizard. So here, Allie, let me see. I'm trying to make you the presenter right now.
Thanks, Kristen. Are you hearing that beeping noise?
I am. I think it might be, that's odd. It might be someone's phone on mute. I'm not sure. Let me try to, I just made you the presenter, so I'm not sure if you can go on and
do you know how I share? So share my screen. Okay.
Did that work?
Great.
You might have to go on there, and if you want to, if you're able to, try to mute all the callers, because then that will probably hopefully make that beeping noise go away.
Are you able to do that, Kristen?
Let me see.
It looks like it might be user 6. Calling user 6. There we go.
Yes.
Okay.
Good job. Okay, I'm going to unmute the other callers. Okay, great. Thanks, Al.
Excellent. All right. So can you guys see my screen okay? Can you see it, Kristen?
I can see it, definitely. Sorry.
Okay, great. All right. Hi, everybody. I hope all of you had great long weekends. I am here on the call this morning to review the MeHealth PDSA Wizard with all of you. And the PDSA Wizard is really an alternative to the PDSA worksheets that I know all of you have been using for your improvement work in your practices so far. And we wanted to read this with you because we think it's just a great option for a number of reasons that I'll show you here in a second. So the test wizard is housed in the report card section of the MeHealth portal. And I apologize in advance, my internet is a little slow loading these pages, so it's going to be a bit of a delay. But one big note is that everyone with MeHealth access at your practice can see the test wizard section of MeHealth, but only the admin at your practice can create and edit tests of change. But only the admin can create and edit tests of change. So if I'm logged into the AAP's admin account right now, but if I log into my personal account, I would only be able to approve certain tests, but not edit or delete them. So this top section right here is where the test of change wizard is housed. So if you click this link right here, test of change, it will expand, show all of the tests of change that you have created at your practice. So like I said, this is the admin view, and that means you can edit and delete over here on the left-hand side. But if you are not the admin, you'll see an option to check a box and approve the tests that your practice is working on. So here you can see that we have a lot of fake tests that we've created here on our AAP account, but it includes the measure you're trying to improve, the test of change that you're making to improve that measure, and then it includes the date and an annotation. And the annotation feature is one of the reasons we like this tool a lot, is because it creates a little brief description of the test of change and then annotates it on the charts below. For example, here you can see that for this measure number of patients registered in the web portal, there's a number of annotations for that measure throughout. So you can see how your data reacts when you are doing a certain test of change at that point in time. So to create a new test of change, you just go up here and click Create New Test of Change, and that opens up the window here where you can select all of these different fields. So the date automatically populates to the date that it currently is, but you can backdate things if you'd like. Then you need to select a measure to improve. So for the purposes of this exercise, I'm going to select percentage of patients with completed teacher rating scales during assessment. We've heard a lot of people across the practices struggle with that one. So do that one for this example. After that, you have to select a problem. So for other measures, there might be many problems listed under here, but for this measure in particular, there's just one. It's that the teachers are not completing forms. If there's another issue, you can create a custom one, but then when you create a custom one, the reasons and tests of change don't populate later on in the process. So I'll select teachers are not completing forms. After that, you have to select a reason. So again, these populate, and these are populated based off of MeHealth's experience from other users. So they have found that these are the most common reasons for teachers not completing forms. For the purposes of this, I'll select that the teacher is just not responding. And then the final step is to select the test of change that you want to try. I think there might be somebody not muted right now, so just check your phones. So then, under test of change, the neat thing here is that the tests of change that the wizard suggests are actual tests that the MeHealth developers have found in trials on the portal. These are evidence-based solutions that have worked for other physicians. So here there's two options, and it basically just gives you ideas for things that have worked for other physicians in the past. So the two options here are create office process for contacting parent if there's no teacher response within 7 days, and then the second is to provide parents with a paper version of the teacher ratings, and then create the process for manual entry of rating scales. So let's say based on your population you think that doing the paper version might be best. So then after that, you have all of these selected. You can click Save. And it will show up here at the top of your test of change list. And you can see that the annotation is default to paper form. So if you scroll down to that measure, you should be able to see that annotation on that quarter on your chart. And you can, up here with the checkboxes, only show parent or teacher or neither annotation on there, but we have both checked right now because we thought that was useful. So that is really it. It's pretty straightforward. One note that I want to make before we open it up for questions is that you still can use your PDSA worksheets, and I know that Kristen is very diligent about collecting those from all of you, which is a great practice. But this really develops a lot of evidence-based ideas and gives you ideas for things that you could try based off of the problems that you're encountering, but you still will probably find it useful to fill out the PDSA worksheets for the very minute details of your PDSA plans. So just something to keep in mind. So any questions from the group? All right. Kristen, I guess I'll pass it back over to you.
Thank you. And I am trying to mute the, okay, there we go. Thank you so much, Allie. And I really appreciate that. That sounds like a great way to create PDSAs. And let's see, did you already pass the screen back over to me?
How do I do that?
I think you go up, it's usually up at the top for me. And it'll say, let's see, view.
Oh, here, presenter. I think I did it.
Here you go. Thank you so much.
Sorry, I haven't used this before.
Oh, no worries. Let's see. Okay, great. I'm going to try to move this. Okay, great. Thank you so much, Allie. I really appreciate that.
Yeah, sure thing.
Okay. And
yeah,
then,
and anybody can feel free to ask me, send me an email with questions if they run into it, but it's pretty straightforward.
Perfect. Very helpful. Thank you. And we can move along to roll call. And I usually ask you about your PDSAs while I'm on here doing roll call. And the first one we have up is Central Arkansas Pediatrics. Amber, are you on the line? I know I muted a couple people, so I've got to try to find this really quick and try to unmute everyone because a few people had some beeping sounds going on. Let me see if I can unmute everyone. I don't know if you can see this. Okay, so sorry. Amber or Cheryl Arnold from Central Arkansas Pediatrics, I'm just wondering if you're online and would like to go over your PDSA worksheet. Okay, it doesn't sound like you are, so I'm going to move along to River City Pediatrics. Roger, are you on the line today?
Yes, I'm on the line. We had some trouble getting.
Yeah. That happens sometimes. I'm very sorry about that. And I know that this is kind of hard to see, so maybe I can bring it up clearer on Word if everyone can see this PDSA worksheet from River City Pediatrics. Roger, would you like to tell us about it?
Oh, okay. Well, I can't see anything, but I'm on the audio really because we're having trouble with technical problems on our end. But this is just our second PDSA. The last one, we got a 47% response with getting parents to activate the portal. So we've changed to like resend the letter and also remind them when they call in for a refill. And so far at the end of this month, we're looking at about 56 or 57% response. So it's improved a little bit. I'm not really sure, how well it's ever going to get in the ideal world, but I would like to hear what some other people are finding out, like what kind of response they're getting from parents and teachers and how they're dealing with the summer when teachers aren't around, and a lot of parents aren't getting refills anyway. So maybe we'll discuss that later on, but that's kind of an update from us for now.
That's great, and these are great steps that you made here. Resending the letter and reminding parents who have not activated to refill and following up on the portal. These are great steps. Does anyone have anything to add about this PDSA trial? Well, thank you, Roger.
Thank you.
And we can move on to the next. From Sparks, either I'm guessing Ashley or Dr. Nodby is on the line.
Yes, we're both on the line.
Great. Did you want to go over your PDSA worksheet?
Yeah, I'll let Ashley talk about it.
We did, our main project was to follow up appointments or get more feedback from the parents through the MeHealth portal when we start them up on new medication or behavior therapy, and we're seeming to get better reports from the teachers versus the parents.
Through the email.
Through the emailing. And we've also discussed trying to put follow-up calls, reminder calls in our calendar, like our email calendar, so that we can have them respond better and quicker before they come in for refills or follow-up appointments.
That's great. It sounds like the parents are better by phone and the teachers are better by email.
Yeah, that's what we're seeing.
Well, that's great that you were able to find that out and connect with them easier. Thank you very much. And we can move along to pediatric partners. I think I saw Dr. Schluterman or maybe Gail on the line.
Yeah, we're here.
Great. I know that this one's not quite finished yet, and I'd asked folks to even give some, if anyone had any ideas on improving 30-day follow-up, but if you wanted to go over anything that you've already done on this, that would be great.
We are still tracking our data from our 30 days, so we don't really have any information to give back yet. But we have, you know, we're struggling with no-shows during that 30 days, and it also affects our, you know, our metrics for PCMH and all that. So we were trying to tie those together. But, yeah, we don't have any suggestions on how to get them in there. Or how to get them in the
Do any of the other practices online have a effective system for 30-day follow-up that they'd like to share? Okay, well, I had also asked about that over email. So if I get any answers towards that, I will definitely send them out to everyone. And I believe thank you. Our next is Arkansas Pediatric Clinic, but I don't believe I received your PDSA for this month, and I'm not sure if Anne-Marie, are you on the line today? Okay, then we will just move on, and we already asked this question if someone had an efficient system for 30-day follow-ups. As far as clinical questions for this month, Dr. Jensen is actually out of the country. So if you have any clinical questions right now, please just send them to my email, and I will get them to Dr. Jensen, or use the clinical listserv. There's all of the ADHD experts from the 4 chapters and folks from the national team are on this to answer your questions, and other participants can also share their suggestions. It's very easy. Just enter CQN ADHD at listserv.aapa.org into the to line in the email and send your message, and hopefully you'll get a very quick response on any of your clinical questions. I have a few reminders and announcements. If you have need health questions, please contact Ed. I'm sure you all have his email, but I can send it out again. The May data entry closes on Sunday, June 5th. Our next Learning Session 3 is July 8th at Little Rock Embassy Suites, and if you are coming from afar and you would like a hotel, please just let me know. Our next monthly call is June 28th, and I have a challenge on this webinar. If you can, try to use the PDSA wizard for our next call, for your next PDSA cycle, because it seems very helpful. And with that, I'm wondering, Jen, are you on the line already? We have Jen Powell doing our review of data for this month.
I am on the line, yes.
Great.
Unfortunately, I am not having internet connection, and I apologize.
No worries.
Are you ready to do the data report now? Is that what you're saying?
Yes, if you're okay with that, and can you?
All right. So
I'm wondering if you can.
I'm going to tell you what page to go to. Okay.
Sure.
All right.
Okay, great.
So let's go ahead and start with project-wide data on page 3.
Great. We're on that right now.
Okay, great. So hi, everyone. This is Jen Powell, and I'm looking forward to seeing you all in early July. We continue as a collaborative to struggle on a couple of fronts that you all have talked about today on this call, which is this whole business of getting the Vanderbilt scales back. And it's really interesting because as I listen to the calls across the state, there seems to be variation regionally in terms of how parents and teachers want to get information. We've heard that the major barrier with the teachers is that sometimes you can't get through the firewall of the school district to get through to the teacher. So on our last learning session, our webinar that we did, we suggested and recommended that you kind of do a reach out at the school district level. Part of that conversation could be to make sure that anything coming through from Me Health Registry is getting through to the teachers. So that's just one idea of how to improve your email back and forth. If you're not hearing from teachers and you know that email, certainly we learned through the study we did with Me Health that was the best way to reach teachers. So looking at the project-wide data, the Vanderbilts had, we were starting to have an upward trend, but we have moved back down some. So I think the focus across all of the chapters is, getting the Vanderbilt scales back, getting them completed within 30 days of the medication prescription to have an idea how you want to titrate, and you know, and continuing to see if we can't move, you know, the dial, so to speak. We know that the reduction of symptoms will happen as we begin to titrate the meds more and kind of get that feedback loop from our parents. So we hope to move that yellow into green relatively soon across the collaborative. So now let's go to the next page, which is your chapter. And if we go to number 8, patients registered in MeHealth, we'd really like to see that number go up. A great job, Pete's partners, in terms of kind of leading the pack there. You know, having anything over between 5 to 25 or 30 per month is what we really would like to be seeing that. In particular, someone brought up moving into the summer months. So one of the things you may want to think about is how do you want to plan to bring people, your kids back in so that you're distributing those visits in the August time frame so that not everyone is wanting that follow-up appointment right before school starts with the IEP so that they can get their IEP plans and so forth. So I really encourage you in a very near future to begin thinking about your population of ADHD patients and then beginning to think about how you come back in over these summer months to kind of spread it out a little bit and to encourage them to keep up with the medication and so forth over the summer. So I think, you know, I don't need to go through each of these. I have some concerns that the numbers are relatively low in terms of the number of patients. So again, I think getting the focus in terms of getting the patients entered into the portal as we've been discussing on the PDSA cycles. So I think that probably is, if we go, actually let's go to the individual questions. I think that starts on page 10. Again, we've got only 1, 2, 3, 4 practices, and I think most of them are on this call today, that are even, you know, kind of getting the assessment data in. So, Kristen, I know you and Dr. Kuo have been reaching out to some of the practices where we don't seem to be getting, you know, activity. And because we're coming up on towards the end of MOC Part 1, we just want to make sure that you all are in a position to have met the requirements. And again, I know Christy will be reaching out to you all. You know, page 10, page 11, patients diagnosed with a documented thorough conversation. These numbers are low. As you move up to the Vanderbilts within the 30 days, again, this is showing you by practice how things are going. So, you know, Sparks, you know, good work in terms of getting up to our goal of up to 60%. And Pediatric Partners, you know, really doing well with that. So we'd love to hear more about what's working for you all. So I think that's probably, if you actually go to page 14, percentage of diagnosed patients who are prescribed behavior therapy. Do we have Sparks? I know you all are on the line. Can you tell us what you're doing that's getting that in the green? Is it just a matter of being diligent about signing off on that in the MeHealth and stating that you're prescribing behavioral therapy, or tell us what you're doing?
Jen, was that for Sparks Pediatrics? Because it broke up a little bit. I'm not sure if they can hear you.
That was for Sparks Pediatrics.
Okay.
On page 14, they're in the green zone. Dr. Napi, are you still with us?
Yes, we are. About the behavior therapy, we are referring them, and it's actually easier to get the children who have Medicaid insurance in to be seen. A lot of the ones with private insurance, trying to get a provider, a lot of times the families have to call their insurance to see who their coverage is, and then once it's up to the parents, we've had so many cases in the recent past couple of weeks where They're not keeping their appointments once appointments are made. So we are a bit frustrated, especially with the private insurance ones. And there are some Medicaid who just are not following through with the behavior therapy. So it's a lot of teaching that, you know, medication is not the only thing. They need to follow up with the appointments, but we are trying.
Well, that's great. Looks like something's working. Go ahead. Does someone else want to make a comment? Okay. Great. Well, that's interesting that your Medicaid patients seems to be an easier set of steps. And I'm disappointed to hear that people are not keeping appointments. So I think you're spot on in terms of encouraging the value for the parents to be getting some behavior management coaching.
Yeah, that's been the most frustrating thing because a lot of them think, you know, well, we've got the medicine, what more do we need? And so it's every follow-up appointment. It's like, have you got your appointment? Have you made the appointment? We've had one place where they no-showed twice and they're not even going to see them again. So, and with private insurance, we have very limited options of where to send them in town. So that's been a bit frustrating to get them in to follow through with their behavior therapy.
Right. Okay. All right. I think that'll do it, Christy, for the data report today. I think I've kind of given a high-level view and, you know, featured one practice that seems to be having, you know, some consistency in terms of marking that behavioral therapy consultation was made. Regardless of whether there was follow-up or not, we certainly can't control that. And that's, you know, our measure is reflecting the primary care physician's reminder of the importance of behavior therapy according to our guidelines. So I'll hand it back to you.
Great. Thank you so much, Jen. And just to make sure no one has any additional questions on the data for Jen today. Okay, great. Thank you guys very much. We have our PCMH webinar coming up at 12:45, and we're actually ending somewhat early today at 12:30, so there's about a 15-minute segue in between the two. And I just wanted to make sure that no one on here has any additional ADHD-related questions that I can help them with.
Hey, Kristen, this is Dr. Chris Schlitterman in Fort Smith. This may be a question for Ed Wise, but we've had some parents that are also teachers, and so they have an account as a parent, and then when we try and send it to them as a teacher, because they also are teaching a child that as one of our patients, they're not able to create a second account using the same email.
Mm-hmm.
So that may be a question for Ed, but is anyone else having issues with getting people I had the same thing with my daughter. Like, we tried to do one on my daughter, and we weren't able to because I was already in the system as a provider.
One thing you can do is ask the parent to give you to use the Gmail address for their own personal correspondence around MeHealth, and to use the teacher account, the EDU, for their teacher role.
Yeah, that's what we ended up doing for mine, but I have to, you know, it's hard enough to get the teacher's email address that trying to get two from sometimes is hard.
I bet, because I was going to say, yeah, you would think that one parent could have one email and you know, use the other parent's email for the other account, but yeah, I completely understand that it's hard enough to just get one email address, but, and I'll also, Ed's not on the line right now. He actually just had a baby, but I'll definitely give this to Ed, because maybe there is a way for one email to be used under two separate tabs. So I'll ask Ed about this as soon as we're done. And thanks for the question. That's, I'm sure that a lot of teachers are also parents and physicians and everything else. Are there any other questions for today? Okay, well, I really appreciate the work that everyone is doing on this project, and I completely understand that some are not doing this for MOC and have some people that are not physicians entering data who do not do their very first initial diagnosis, so sometimes it's more difficult for those practices to get their data in. But I definitely appreciate all the data entry and the other hard work that everyone is doing for this project. And please email me or text me, call me at any time with any questions. And we will...
I did have one question.
Oh, sure, great.
On some of the patients, MeHealth will send an email with a notification of a side effect or worsening symptom or something. So, you know, when you go on to MeHealth, it comes up as a red bar that I have acknowledged and I know of this warning. After I've talked to the parent, is there some way that I need to document on MeHealth that I have addressed this issue with the family, or just document it in my patient chart like I'm already doing?
That's a great question, and one I'm going to have to ask Ed again, but for now, probably definitely keep documenting this in your patient files just in case it would need to also be put into the MeHealth portal.
Yeah,
but
okay.
Thank you. I'll ask Ed and I'll get back to you with this one.
All right, thank you.
Any other questions? Okay, great. Thank you very much for joining us today. And the PCMH webinar will start at 12:45, so you got about 10 minutes between the two. So feel free to sign off and back on again, or just wait for the PCMH webinar to begin. Thank you very much for all of our presenters today. I definitely appreciate your help, and text or email me with any questions. Thank you.